Welcome back to CBS 2 News at 9 a.m. on this cool, very nice day, though. It is National Women's Health Week, and according to the CDC, this time of year is to encourage women and girls to make their health a priority. And one topic of concern for some women is family planning and possibly infertility. Here to talk more about this are Drs. Welsh and Keri Greenseid from Valley Health System. Good morning, and thank you for being here.
Good morning.
All right, let's start with family planning. Dr. Welsh, you're an OBGYN. What should people consider when they're beginning the process?
Well, family planning is more than just infertility. So you want to ask your OBGYN and consider, what are my options as far as not having a baby at this point and birth control options? What are my options when I'm trying to get pregnant? And how do I take care of chronic health conditions?
Those are some really good questions. Now, some people might have trouble conceiving. So at what point should they come to a specialist?
We recommend that couples come see us for an evaluation if they've been trying to conceive for a year without successfully achieving a pregnancy, and that's if the woman is under age 35. However, when women are 35 years of age and older, we recommend seeking an evaluation after 6 months of trying, and that's because age has a huge impact on pregnancy success rates as well as infertility treatment success rates. So we want to be able to evaluate patients accordingly so we can get them successful treatment.
And who can be treated by an infertility specialist?
We can treat everybody. Our goal is to build the family that all of our patients desire. We treat single patients, we treat same-sex couples, we treat heterosexual couples, members of the LGBTQ+ community. We treat cancer patients who may be undergoing chemotherapy or other treatments that may render their eggs not viable in the future, and so we offer egg freezing to those patients. We also offer egg freezing to patients who may not be ready to start their family, but they know that age has such an impact on success that we can freeze those eggs now for them to use and have a biologic child later.
I'm still blown away by how far we've come over these years and how to create a family. Now, infertility treatments can be really expensive. So how accessible are they to just, your average normal person?
You're right, they can be expensive. However, we take many insurance plans, and many insurance plans do cover infertility treatment. Also, we have a full staff of financial counselors that meet with our patients at the initial visit and throughout the process, and they review all of the insurance benefits that the patient has and provides extra resources that they may require if they don't have full coverage.
All right. What other resources can people consider when planning a family?
I think that's something very important to talk about with your generalist because, as she said, a lot of women are delaying pregnancy. So people think of IVF as just an IVF. There are so many other technologies that are used and it's not always a woman thing. So when people think about fertility, they think the woman is the problem. But some men have problems as well. So talking to your OBGYN and finding out the resources is extremely important.
Okay. I'm wondering, are there any myths that you'd really like to bust today regarding, when planning a family and where we are with infertility? I think some women need to give themselves grace. There's only a 20% chance every month of achieving a pregnancy. And some women really need to give themselves grace. So that's a myth that as long as you have sex, you're going to get pregnant. Sometimes it takes time. Any myths you'd like to?
I think that the resources that we have at the Fertility Center are so successful, and I don't think anybody should give up without coming to see us and giving themselves a chance, because I think that we help almost every patient that comes through the practice.
Thank you both for being here. You do such important work, creating families, healthy families, and it's really nice to have you here.
Thank you for having us.
We're going to be right back.